Hi, this is Dr. Miles Spar. I am fresh from the AIHM 2018 conference. It was amazing. So much to cover. I couldn't explain it all in just a couple minutes, but wanted to give you some highlights from a men's health perspective. I was able to do a keynote on Sunday alongside Sarah Gottfried and Tori Hudson, who spoke on women's health. If you weren't able to hear my keynote, feel free to text the word toolkit to get my men's toolkit on how to engage men. The word toolkit to 323-310-5223. 323-310-5223. Text the word toolkit for that. Some really amazing talks that I heard. One was by a guy that I had never heard of before named Bob Johansen. He's from the Institute for the Future. He wrote a book called The New Leadership Literacies, talking about how we live in this new world we need to learn to adapt to, but there are amazing opportunities. He calls it a VUCA world, V-U-C-A, volatile, uncertain, complex, and ambiguous. However, it will reward those of us who can really use economies of organization rather than economies of scale and learn how to organize, that it's all going to be characterized by kind of a scramble, but that there are opportunities in that if you learn to adapt and learn to be quick on your feet, that the future really rewards clarity but will punish certainty. So know where you want to go but not exactly how you're going to get there. A lot of that was really interesting in thinking about how to help men achieve their goals and how to help men with feeling frustrated by this current world and how to navigate their way in it. After that, Scott Shannon, integrative psychiatrist, really talked about the future of psychiatry and how much psychiatry is changing in terms of our understanding of our abilities to help people have better mental health, the value of even using LSD and ketamine and MDMA and some of the more severe psychiatric disorders. What was fascinating in terms of men's health to me was his talking about video games and the use of gaming with software that encourages healthy behaviors. How video games utilize the same skills that a mentally healthy person needs to learn to utilize. Things like being flexible, learning from mistakes, managing your identity, recruiting allies, acknowledging and facing challenges, taking action. It sounds a lot like resilience, and it's things we can use to help men be better at making the changes they need to make and, again, dealing with stress in the world. So I really look forward to exploring uses of things like virtual reality and gaming to encourage healthy behavior change in men. There was a really interesting presentation by Dr. Danny Gordon on CBD and its uses and all the science behind using CBD for so many things, which spoke to me because a lot of guys don't want to take a lot of supplements. So if you can find something that is very safe, doesn't have a lot of side effects, but helps with pain, with anxiety, with sleep, with different issues that men are dealing with, but it's just one thing to have to get, that can be really helpful. And then lastly, I just wanted to touch on Joseph Pizzorno, who talks about environmental medicine and practicing environmental medicine and how he, in all his work with corporate clients, has never found someone that wasn't deficient in some nutrients, mostly from some exposure to different toxins in the environment, and how much that affects things like erectile dysfunction, which can be related to exposures like organochlorides and pesticides, like benzene from pumping gas, and even fertility issues in men related to phthalates, related to parabens, related to PCBs and in the environment. So really paying attention to what guys are exposed to when they complain of any hormonal fertility ED issues and maybe even measuring that or at least counseling them on how to avoid that, how to help detoxify. So those are just some of the highlights. I'll be coming at you in a couple days to talk more about how to attract men to your practice, how to make sure you know how to get men to come to you, since so many guys don't come to their practitioners. Men are half as likely to have a practitioner. And then the third video in the series will be about how to keep men engaged. Again, we're really trying to help build this whole sense of how we can decrease the difference in life expectancy between men and women, how we can really build this army of people who are skilled at engaging men in their health on the same level that historically women have been engaged. So thank you, and I look forward to talking to you in a few days.